Trans fats are out. The Food and Drug Administration is telling food companies they have 3 years to remove from processed foods most partially hydrogenated oils, a primary source of trans fats, saying trans fats are not safe for humans. Joining us now to discuss is Dr. Suzanne Steinbaum, attending cardiologist and director of Women's Heart Health at Lenox Hill Hospital. Dr. Steinbaum, welcome. So this news from the FDA has been a long time coming, correct? The medical community has been advocating for this for years.
Yeah, we have really known for quite some time that trans fats are really, really bad for us. They increase LDL cholesterol, which is the bad, the lousy cholesterol, and they decrease HDL cholesterol, and this leads to heart attacks.
And there have been clear links. So why has it taken the FDA so long to catch up to all of this?
Well, it's all about research and getting the data. And we know since 2006 that on the labels, the nutrition labels, it's been written, trans fats, are they included, are they not, to warn people. And over a decade, there's been about a 78% reduction in people actually eating trans fats. But in 2013, there's really came out that information that trans fats are bad for us. Right. So it's taken a little bit of time to implement it. And now we have 3 years to see it removed from the food.
But us personally, though, should we be cleaning out our kitchens and our pantries now? What are some of the popular products that everyone loves that are filled with trans fats?
I think one of the most common things we have in our pantry is the microwave popcorn that has trans fats in them. Some French fries have trans fats in it that you'll get from restaurants. But really start looking at your labels because it's there, and it's been mandated to be there since, as I said, 2006.
The labels, that's right. And so what should we know about trans fats? What are they exactly? And what, other than heart disease, what other diseases have they been linked to?
Well, when you look at a food product and see that waxy sort of caramelized processing to it, that's really a trans fat. It's part of the baking, processing, preserving factor that is added to foods. And what it does is change how the food is processed in the body, so it's increasing cholesterol. This cholesterol has been directly linked to cardiovascular disease, but this also leads to dementia. This leads to all the problems of the body where arteries are associated with.
It's all bad. So we can look at the labels on processed foods and we can be careful there. But what about when we go out to eat? Aren't there some foods where trans fats are naturally occurring?
It's not a natural occurring food. This is added to the foods and part of the processing things. And like I mentioned, French fries is one of the most common things. Usually it's in the fast food sort of industry. And I would like to believe that everyone already got the message that fast food is not good for them. But when we look at when trans fats were added to the food, it was during that time when we thought saturated fats were so bad for us. So they took out the saturated fats and added these trans fats and actually sugars. And that was during that low-fat craze.
Yes, when SnackWells and all of those foods, which were better for us.
Exactly,
yeah.
And that was the time when, if you notice, that's when people became more obese, when diabetes started increasing, when the risk factors for heart disease started going up. So that was when trans fats entered our diet. It's not naturally part of anything. It's added. So again, look at the labels because it's there.
Now, these recent restrictions by the FDA, while very strict, fall short of outright banning trans fats. Would you like to see the FDA take that extra step?
We have to do this. We are at a very, very critical point in our country. There has been a 70% increase in obesity. We are looking at children who have elevated cholesterols and high blood pressure, that as a nation, this is really a wake-up call. It's time for us to do something. And believe it or not, just banning trans fats will reduce the incidence of death from fatal heart attacks and cardiovascular disease by thousands and thousands and thousands of people. So it's a moment in time where we have to look at the state of our nation and the health of our country and our kids and say, what are we going to do? How are we going to become more healthy? And I do think banning trans fats is one of the critical pieces to this.
So a positive step for our nation's health.
Absolutely.
Dr. Steinbaum, thank you so much for that.
Thank you.